is Ani Rahmawati. I will giving my opinion about 12 case study. This title is Forced Treatment of the Mentally Ill. Okay, my opinion is yes, I'm agree. Because every individual of adult years and sound mind has the right to determine the course of his medical treatment. This fundamental right is coextensive to mentally ill patients. The fact that patients at that facility are mentally ill or have been involuntarily committed doesn't constitute a sufficient basis to conclude that they lack the mental capacity to comprehend the consequences of their decision to refuse medication, and to understand that their refusal poses a significant risk to their physical well-being. This case came before the Court of Appeals of the country after the trial court had dismissed the patient's complaints, mainly the right to refuse medication. In addition, the trial court determined that these patients were so impaired by their patient illness they were unable to make a competent choice in respect to their treatment. The lower court affirmed the dismissal, and the patient appealed. The Court of Appeal reversed the ruling, stating that the individual must have the final say in respect to decisions regarding his medical treatment. To ensure that the greatest possible protection be accorded with his autonomy and freedom from unwanted interference with the furtherance of his own desires. This right extends equally to mentally ill persons who are not to be treated as persons of lesser status or dignity because of their illness. Respecting a person's dignity commits us to respecting his choice. Being mentally disabled doesn't preclude the right to choose and to be respected. A person's dignity is not embodied in his ability to choose, but rather exemplifies his existence as a human being. That being the case, is it not a question of respecting a person's choice and, as a consequence, respecting him, but rather respecting him as a human being and, as a consequence, respecting his choice. Thus, mentally disabled people have the same degree of dignity as any other human being, and their choice should be respected. For example, they have the right to refuse treatment. Every patient's decision must be examined in light of the specific circumstance. A patient who chooses to be hospitalized is not automatically considered to be a person who agrees to every treatment. Denying their rights on the grounds that they are incapable of making meaningful decisions cannot serve as an excuse for forced treatment. Furthermore, informed consent is a basic right that is based on the recognition of the patient's human status as a free man and on society's obligation to respect his dignity. Refusing treatment is part of the patient's expression of autonomy and dignity. Yes, this is my opinion. Thank you.